In a recent study, it is found that 10 to 15% Indian married couples are suffering from infertility issues. That amounts to almost 27.5 million people suffering from it. What is infertility? What are its causes? What are the treatment options for such patients? Let's find out from our expert, Dr. Neha Gupta. Dr. Neha Gupta is working as Senior Infertility and IVF Expert at Mediworld Infertility and IVF Center, Sukhdev Bihar, New Delhi. Dr. Neha, what is infertility?
Infertility can be defined as if inability of a couple to conceive within 1 year of unprotected intercourse. अगर कोई कपल एक साथ एक साल से रह रहे हैं and कोई contraceptive नहीं यूज कर रहे हैं and if there is no pregnancy in 1 year, we call it as infertility.
Dr. Neha, what are the causes of infertility?
So infertility is on a rise, definitely. There are multiple reasons for this. The most common being that delayed age of marriage. So women used to get married earlier in olden days, but then these days with lot of career option, changed lifestyle, the women are getting married at a later age. Secondly, there are multiple factors like environmental factors, a lot of stress, lifestyle factors, increasing weight, dietary factors. Then males also, there's a lot of stress in their life because of which their semen parameters are getting deranged, and a lot of tubal factors because of multiple sexual partners. There's so much of infections, tuberculosis. These are the most common factors. Polycystic ovaries, endometriosis. These are the main factors causing this rise in infertility.
Dr. Neha, what are the treatment options for such patients?
So if we talk about the treatment options, I feel the most important thing is a proper workup. We have to work up the patient properly. What is the reason why they are not getting pregnant? A detailed history, a detailed examination, some basic tests like ultrasound for the female to see if her ovaries are fine, if her uterus is okay, there are no fibroids, there is no active endometriotic cysts or lesions inside the ovary. How is the ovary? How healthy it is? The male factor, routine semen analysis, a tubal patency test for the female. These are the main investigations by which we can find out, and then based on the factor which is responsible for this infertility, we can guide them and tell them what is the best way that we can treat them. So treatment options can include lifestyle modification, dietary modifications, exercise, and if there is any infection in the tube, we try to treat it. If it is a mild male factor, we try to improve the lifestyle for the male, try to find out what is the reason, correct it, and accordingly, we can prescribe them certain medicines which can help them in improving the sperm count. Similarly, for the female, in case if there is an ovulatory dysfunction like in polycystic ovaries, we can give them certain medicines which can help them produce a healthy egg and get pregnant. The other options being IUI, which is a very simple process by which we can cause a good egg growth in the female and put good sperms in the endometrial cavity to cause better fertilization rate. And if 3 to 4 cycles of IUI also doesn't work, then probably IVF becomes the good option, in which we can treat couples who are having problems related to tubal factor where both their tubes are blocked, or in case of severe male factor which is not correctable. In those cases, IVF works very well.
Dr. Neha, thank you so much for coming on our show and giving us this valuable information.